I'm from the other side of the coin. I'm the person you treat, you analyse and help recover, which makes me a stroke survivor. It's actually nice to have a room of people who aren't exactly surprised, because you know that strokes happen at any age. Mine happened 2 years ago, at 22. I had just finished my 4th and final year at uni, celebrated by spending my life savings on travelling, and was working alongside career-driven people like me. I was a new grad at Deloitte, working as an IT consultant, and I wanted my own piece of the world. Sure, I was working long hours doing process maps, but finally I was doing what I loved and felt in control of my life. But after 4 months, it stopped. After a big night, I awoke feeling perfectly fine. I got up, went to the bathroom, and Mum asked, "How was the night?" But what came out was something like Charlie Brown's English teacher. And I thought, that's weird. Had I been drugged? My next thought was, where's my brother? So I went downstairs, knocked on his door, he opened. Yeah. And the same thing came out. To which he replied, "Are you still drunk?" My next thought was, I tried to type "can't wait" on the computer, but by then I was zoning in and out, and that's when my right side collapsed. I was transferred from Sutherland Hospital to Prince of Wales, and after 3 days, 2 MRI scans and 1 angiogram later, it's found that I had an AVM, arteriovenous malformation, which from what I understand, from birth I had a funny connection between a vein and artery that ruptured and caused my stroke. The AVM was right in the heart of my language centre, bled outwards and caused my right side to shut down. The AVM wasn't too big, but the bleed was just bigger than a golf ball size. And that took me back to square one. I was an infant. I couldn't walk, talk, say yes or no, read at all. And because I couldn't see or hear properly, my sense of smell was overcompensating to a point that I could physically taste every ounce of cleaning chemical, bleached towel, and even hand cream. My poor mum, I remember pushing her away because I couldn't bear the smell of hand cream. So here's me in Prince of Wales, chowing down some surprisingly good mash. It's quite good. My parents and I did our best to pass the time. As you can see here, my dad's clearly paranoid about giving him his germs. And for a month, this was my view. Good news is, I'm much better. In fact, I'm driving, so look out. I am back to work at the same company, part-time for now, but only after traveling Europe for 7 weeks. So I'm still broke. As wonderful as it is that I could restart my life, it would be foolish of me not to acknowledge how I got here. And that how more importantly, who. I used to hear from people that they knew person who made a full recovery. And I think that's amazing. But now I pay less attention to the full and wonder about the support team behind that person. Sure, at the end of the day, I'm the one who's doing the numerous mundane exercises, but this is a marathon. My family was my support crew. My brother, who made use of his research skills and shipped a biofeedback glove from Israel. And day after day, still now, we do my hand-arm exercises for 2 hours. My dad, who's in charge of me eating well, always healthy, and at no point am I ever cold, because he understands that if I don't get enough circulation through my fingers, they just don't work as well. And my mum, who, if left her own devices, will organise all the bits and pieces that no one else thinks about. Things like cleaning back Medicare, filling out forms. And even though I've been so blessed to not have to worry about oversensitivity or even supporting family, this is a proactive involvement necessary to get one person back up on their feet. Without the support, I realise the day I eventually get better would be a long time after my sanity runs out. But before all this, before the relearning, the rehab, was the readiness of my mental state to embark on this colossal task. For the longest time, I was in shell shock. My mind wasn't there, and I couldn't see past the day that was ahead of me. But luckily, my parents and my family, they did all the thinking for me and made sure I was keeping well mentally. Explaining what happened, this is what we're going to do, and this is where we'll end up. And it turns out that having a boyfriend isn't dissimilar to having a shrink, because he was willing to listen to my slow and distorted speech and refuted my doubts. I know me being here today is credit to an early acceptance and constant moral support. Unfortunately, unlike me, older stroke patients don't have this intense support that's required, which poses the question, why aren't patients given counselling support as part of their rehab? I believe this shouldn't be an option, but a mandatory service. Can you imagine doing heel raises 3 sets of 10 when your mind's fixated on the angst and heartache of what happened and what this means for your future? Believe me, not being able to use my right hand was like going through the 7 stages of mourning. But eventually, I got into a routine of what I called my 9-to-5 job. I went to many appointments and did everything necessary in terms of my rehab. But what kept my spirit alive, that yearning to get that out there, not that staying home every day with my parents wasn't riveting enough, but my boyfriend would take me out of the house to regain some normalcy, and I relished chances to interact with people, sometimes people I'd meet for the first time. I reaffirmed my sense of self and that, yes, I'm still the same person. But people who know me also know that I can't not talk. so I used that as a rehab tool in everyday events, and thus I grew more confident, but also more at peace, that even though something devastating happened to me, this wasn't going to be my one defining point, and with my support team, I was always going to be okay. But, of course, I saved the best till last. As OTs, physios, speech pathologists, and doctors, you're in this support team too. Through you, I learned the most valuable thing, which is intensity is what gets you on the right track. But more importantly, it's variety that keeps you going. There were countless times where I truly believed I'd be doing the same exercise of lifting up my arm until, I don't know, I was 50. It's so hard to keep your mind on the ball when it feels like it's traveling in slow motion. You and I both know it's hard work that gets you rewarded. But me knowing this crucial fact doesn't entice me to flee to my room and do 1,000 reps of everything. Instead, we can do essentially the same thing by using a variety of exercises that use the same muscles and movement, and thus imposing the same intense, purposeful exercise. Plus, it's more fun and naturally I do more. At the moment, I'm particularly enjoying hitting balls with a tennis racket inside the house for something different. To give you an example of the variety of exercises I do, this is my typical week. Every day, I have 3 boxes to tick. First is walking, be it in a higher pool, walking along the beach, up a hill, or on a treadmill. I also walked a lot in Europe, at least 6 hours a day. And second is upper limb. So I stretch and do gross arm exercises first before doing more dexterous things like picking up marbles and balls. I've also done weight-based movement therapy run by Dr. Penelope McNulty, who is probably somewhere in the crowd today, and constraint-induced movement therapy. I found that having these blocks of therapy help break out my routine and monitor my progress, but better still, challenge what I'm capable of. Recently at CIMIT, I was asked to put these little wooden pegs called dowels into little wooden holes. All the OTs know what I'm talking about. But I bit my lip thinking, are you sure about this? And after what seemed to be a while, I had completed my first 9-hole peg test. I've also purchased a few gadgets like the Saber Flex that encourages finger extension and the hand shooter. These devices stimulate my mind into doing more or new activities. And third is speech. I read the newspaper, novels, sometimes aloud, speak to people, friends and family, one-on-one and in groups. But I have a confession. I tell you this in hopes to inspire some different rehab methods. But I used to call unsuspecting businesses like hairdressers and beauticians to make appointments and then cancel them the next day. Not surprisingly, I had to divert my calls into new places after a while. But I find that this formal use of speech, speaking to someone who has no idea of what happened to you, is the purest form of feedback on how audible I am. Your job is to educate, instruct, and encourage us. You realize the mess the stroke makes in a lives, but also know the one finite factor you can control is that person's rehab. A patient's success is one collective glory of 30 people who gave their time and expertise. Yes, I was willing to do the hard work, but without the right guidance, all those painful hours of doing the same old exercise would have been for nothing, had you not taken the time to formulate the optimal strategy for that person. So continue to have faith in us, extending out our fingers. Continue to encourage us to walk further properly. And continue to have patience when we say the same multi-syllable word for the 100th time. Which brings me to my most important point. If there's nothing else to remember this, that all stroke patients are different. Yeah, we know that, but I feel for some of you, from reading this in a textbook for the first time, to you being in this profession for years, it's not surprising that you've been desensitized to what you know as medical fact, to the potential of the person's spirit. I want to suggest that all people have this innate ability to surpass these odds and not have you think, oh, they got back more than expected, as an afterthought. When I was still in my acute phase, I was unnerved to discover my doctors already knew exactly how my recovery would go, including sequence, shoulder, elbow, wrist, thumb and thin fingers, and time frame. But for me, it was my bicep, my traps, and my ring finger that came back first. 2 years on, and I'm still improving. I do understand as professionals, you're obligated to inform us of the normal recovery. But from what I've seen, there is no normal. There's common, there's typical, but why would we give this percentile so much emphasis? Honestly, the only disability I've had to face is being told what I can't do. The memory still haunts me as I get told by my rehab doctor from the foot of my hospital bed that people live with using one hand all the time. Although true, his matter of fact and callous manner in which he informed me of this was only 6 weeks post-stroke. And our desires to protect our patients by giving them the cold, hard truth about their medical prognosis and expected quality of life, we have to make sure we don't put the first brick in a wall that will actually disable a person. By not treating that person's spirit and potential, we have already determined their failure, even before they've completed one of 10,000 hours of rehab. So, I'm suggesting, don't base your treatment using stats, because maybe that person's an outlier. Get to know their physical and emotional state and say to yourself, it's okay to sidestep what would be the next step in a typical program. There is no normal path, and the implicit beauty of this is your patient can still surprise you. So do ask for another colleague's opinion. Do trial and error. Don't compare us, but do remain curious, because each one of us is different in our personalities, in our own paths to recovery. Thank you.
Thank you, Stephanie. Fantastic. Do we have any questions? If you have a question, please go to the microphone or send us an SMS.
And while we're waiting for those questions to come in, I'd like you to also join us in applauding members of Stephanie's family who have come along for this presentation as well. You're not daunted by this personality in the front, are you?
Can I ask you a question, Stephanie?
Sure.
You're now back at work.
Yes.
How do you find, have you got any advice for people about sustaining ongoing time in rehabilitation? You obviously have fitted that into your schedule.
That's true. Luckily, my workplace is quite supportive. I know that fatigue is a big thing about going back to work. So at the moment, I'm only doing 3 hours a day, about 10 to 1. So what I usually do is go back home and do, I don't know, a 20-minute nap before doing more just strenuous things like the arm-hand exercise, maybe going for a walk, and also spreading out the days I'm working. So at the moment, I'm doing Monday, Wednesday, Friday, and having a Tuesday, Thursday as a full day of rehab still.
Okay, we do have 2 questions. The gentleman up the back, have you got a booming voice?
I hope I have, so I won't get down there. I am 11 years post-stroke. I would like to congratulate you for getting up there and speaking.
Oh, thank you.
It is absolutely wonderful to hear you.
And for you too.
I'm a rehab physician from the Gold Coast. Stephanie, thank you and congratulations as well.
Thank you.
Thank you for sharing your story. I recall as a rather inexperienced and immature registrar telling a spinal cord injured young 19-year-old chap that he'd never walk again. And that completely destroyed our therapeutic relationship. So I'm just wondering if you could comment on how you progressed with your rehab doctor after he told you you could just learn to live with one arm at 6 weeks.
Well, first of all, I think this is your job, so I completely understand that inevitably it's quite, normal to tell people things like that. But just think about every time you have to give something so heartbreaking as news, to think about, well, if that was myself, how would I take that? And also in terms of my rehab doctor, and maybe it's just a personality thing, but I'm very, very stubborn. So I thought, well, I'll show you. So really, I kind of fueled that as even more encouragement.
Okay, thank you. We do have a question on SMS before Simon comes up. Do you have any advice, Steph, whether clinicians should ever give cold, hard facts, that is, after a long period of rehab?
I do think that science does have some grounding, so I think you have to give the most utmost honest fact for each patient, but also give some hope at the same time. So not to give up, especially during the acute phase. Yeah.
Okay, Simon?
Stephanie, I'm a neurologist, so I see people acutely rather than later on, but I congratulate you on your stubbornness. And, I have 4 children, and I know amongst my children there's no similarities. They're all unique and different. And I think when I teach medical students that although it's very hard because we see a lot of people, we have to maintain that idea that each person we see is unique and individual. And it's tough, as you know, because if you do your work, you get used to it, you get used to people. But I think it's part of the mandate of being a good clinicians, whatever we are, to maintain that. And you're a unique individual and person. Your courage is humbling. So thank you.
Thank you.
Ian's just typing the last SMS message. In text, so small I can't even see. So the SMS is, do clinicians give your family specific tasks to do with you and involve them?
I'm sorry, can you say that again?
So are the clinicians actually asking your family to work with you?
Actually, that's a good question. No, I don't think I've ever gotten direct instruction from my family to get involved. But I guess for my family, it was just natural to help me out. So I would implore you to involve the family. Yes.
All right.
Thank you.
All right. Please thank Stephanie. Finish the session now. Do go to morning tea, and reminder that